Okay, well, let me welcome everybody to this critical meeting on the importance of Medicare Advantage programs and providers. Changes are happening. My name is Keith Ellison. I'm the Attorney General for the state of Minnesota, and we want to welcome you to this important press conference because at the end of the day, we want our seniors to have choices. We want people to be able to make good decisions about their health care. And so we consider this a critical information sharing and want to encourage people, particularly on this week when families are going to be getting together, to discuss this issue of Medicare Advantage, and the proper plans, particularly in our rural communities. There will be changes, and these things should be discussed with families. So, Medicare is a vital program for more than 1 million Minnesotans. It helps folks over 65 and people with long-term disability to get the access to health care that they need. We're coming to the end of the Medicare open enrollment period, and when people across the state are choosing Medicare plan that's right for them. This year, there are some changes that could affect tens of thousands of Medicare beneficiaries who also rely on Medicare Advantage plans. Medicare Advantage plans are private health plans with additional benefits like vision, dental, and hearing that aren't available through the traditional Medicare program through the federal government. Around 600,000 Minnesotans rely on these Advantage plans, but this year, a few healthcare provider networks in Minnesota have opted not to participate any longer with some specific Medicare Advantage plans. This means that Medicare Advantage plan enrollees will see much higher out-of-pocket costs for services at these providers, or even worse, their services at those providers won't be covered at all. This could be true even for providers that Medicare Advantage plan members have been using for years. And so healthcare costs and medical debt are already challenging for far too many Minnesotans, and that could get worse if folks aren't able to make informed decisions. I want to make sure that Minnesotans in every corner of our state take the time to get the facts about which providers and Medicare Advantage plans in their area are working together, which are not. I don't want anyone left holding a bill they didn't expect or one they can't pay just because they didn't have the facts to begin with. So that's why we're having this critical press conference today. It's important to have all the facts now because enrollment for Medicare Advantage plans ends in less than 2 weeks, folks, less than 2 weeks on October 7th. If you or your loved ones haven't already done so, this upcoming Thanksgiving weekend would be a great time to sit down and talk about the facts about Medicare Advantage, and make sure that your benefits are all taken care of. Make sure that you're fully informed about your options. And if you choose to enroll in Medicare Advantage, select a plan that makes sense for you. I want to thank folks at the Senior Linkage Line, some wonderful, dedicated public servants, Minnesotans, and the Minnesota Board of Aging for raising awareness on this issue. Bless you all and thank you. These experts are helping older Americans, of which I'm getting closer to being one every single day, thank goodness, are helping to navigate on so many issues. From housing, long-term care, planning for the future. They've been taking calls from concerned folks day in, day out, and this is a chance for them to get this Medicare Advantage information to more people who need it. So let me just introduce everybody to a great Minnesotan, Moren Schneider, Chair of the Minnesota Board of Aging, and Medicare Product Manager, Joe Griner, to take us all through the details on who's affected by this change and what people need to do about it. I might also add, they're very good Minnesota Vikings fans. So take it away. Thank you very much.
Thank you, Attorney General Ellison, and greetings, everyone. I'm Moren Schneider. I'm chair of the Minnesota Board on Aging, a governor-appointed state agency. And on behalf of the Minnesota Board on Aging, I really thank the Attorney General's office for helping shine a light on this issue that affects so many people on Medicare in Minnesota. The Senior Linkage Line, it's a service of the Minnesota Board on Aging, and it is the sole resource in Minnesota that provides comprehensive and unbiased Medicare assistance. We are currently in the midst of Medicare open enrollment. And this is the time when people on Medicare review their options and they select a Medicare plan that best meets their individual needs. While open enrollment has always been a busy time for the Senior Linkage Line, this year has been unusually so, with so many healthcare providers withdrawing from Medicare Advantage plans. And this is a problem for beneficiaries who want to stay with their healthcare providers for 2025. And so, having said that, there are strategies in place to help those Minnesotans on Medicare who are impacted by this change. And I'm going to hand it off now to Kelly Jo Griner, the Senior Linkage Line's Medicare Product Manager, to address some of those details. Whenever you're ready, Kelly Jo.
Thank you, Maureen, and thank you, Attorney General Ellison, for agreeing to hold such an important press event for us to be able to get the word out on what is happening in Minnesota. What I'm going to run through, first of all, is just some things that Medicare beneficiaries in Minnesota need to be aware of. And the first step is they need to look at if it's important to them whether or not to continue to see their current healthcare provider. If it's not important to them and they're willing to change, they should still review their current plan in the Medicare Plan Finder found at www.medicare.gov. They want to make sure that their coverage and costs have not changed for 2025. We are seeing not only the provider changes, but plan cost changes, formulary changes, meaning the drugs that they're taking may or may not be covered in 2025 and may have higher cost sharing. So we want to make sure that they're selecting the right plan and that they have the coverage that they need. If a beneficiary wants to continue to see their current healthcare provider, they also need to go to the Plan Finder to review other plan options. And we strongly encourage them to create an account with a username and password in the Medicare.gov Plan Finder. In that tool, they will enter in their current prescriptions, enter in the pharmacy that they are going to use, and then they will get a result of the plans that cover their drugs at the lowest cost sharing and are available in their zip code and county area. It will give them a list of plans, and then from there, they decide what options they want to look at further. We encourage people, really important, to go to the plan website before they enroll in the plan to verify that their providers are going to participate. Medicare.gov does not list the doctors, hospitals, clinics, therapy providers, any kind of medical provider that people may need to see are only going to be listed on the plan's website. So we encourage people to make sure they go to that plan website before they enroll in any kind of a plan. The other thing is we encourage people to enroll in a plan of their choice by either calling the plan directly or enrolling online. If people have questions or need more help with enrolling in a plan, they can call 1-800-MEDICARE 24 hours a day, 7 days a week, or they can call the Senior Linkage Line at 800-333-2433. And I just want to mention real quickly that the Senior Linkage Line is experiencing, as you can imagine, a very high call volume, higher than normal, and our wait times may be a little bit longer than what most people are used to. I want to just show you, as I wrap this up, I want to share with you some slides from the Medicare Plan Finder, which you may find interesting. Just one second here. Okay. Well, it looks like it's not going to work, so I'm not going to be able to share those slides with you right now. Let me try again. I'm trying here. No, it's not going to work. And so what I had were some slides that we can definitely send out to all the reporters that gives you some snapshots of the Medicare Plan Finder, as well as the provider websites and what they look like in terms of where you do the search. So once again, we really hope that Medicare beneficiaries statewide take this very seriously this year and look at what their providers are that they want to be able to continue to see, make sure they're in the right plan for 2025, because it is not easy to change plans once you enter the new year. So we want to make sure people are in the right plan for them starting January 1st. And open enrollment ends December 7th. So thank you very much. And I will turn it back over to Attorney General.
Attorney General, you might be muted.
Am I still muted?
Nope, you're good.
Okay, good, because I don't like being muted. Anyway, so thank you, Kelly, Joe, and Maureen, for those great presentations. Again, we are here to encourage conversations across dinner tables this week. We only got less than 2 weeks, so we need people to have those dialogues about Medicare Advantage to make sure that they don't miss out. It's so important. And, you know, so please do that. We wish everybody a wonderful holiday. And if any members of the press would like to present any questions, we're happy to answer them. Otherwise, we can conclude our presentation right now. So who do we have? John, we got anybody? Brian?
If any members of the media have questions, feel free to unmute and ask those. And if you are not able to unmute yourselves due to meeting settings, feel free to shoot me a message. Got a question from Peter Cox.
You know, let me say, I did see that there was a off-topic question. I'm happy to talk about those things, but I am hoping that I can do it after this. So if you want to talk to me about something affecting the AG's office that's unrelated to Medicare Advantage, we're all up for it. We just don't want to we don't want to do it now. So please hold those questions and we'll get right to you. Any Medicare Advantage questions?
Yeah, Mary Murphy here with Forum News Service. I'm curious if we could get any more information about why some providers are choosing to opt out.
Kelly Jo, Maureen?
Sure, I can answer that. It is what the providers are telling us. The reason that they are opting out is because they insist that the plans do not reimburse them timely, that they are refusing to cover and pay for services that they believe are medically necessary, and that it is taking a longer than normal time, as I said, to pay, but also to process claims and process what needs to happen for them to be able to get the approvals to provide the services they need. So those are really the primary two reasons that this is happening.
Okay, thank you.
Just a quick follow-up to that. Hey, this is Raya with Care 11. Kelly Jo, could you actually elaborate on which healthcare systems based in Minnesota have decided not to opt in this year?
Sure. I can tell you right now. Just hang on one second here. What we have seen in Minnesota is that Allina is not going to participate with Humana. Avera in Southwest Minnesota is not going to participate with Humana. Essentia Health in northern Minnesota and northern Wisconsin is not going to participate with Humana. M Health Fairview Healthcare System is not going to participate with Aetna or Humana. North Memorial Medical Center and their providers are not going to participate with Humana. And Sanford Health in western Minnesota is not going to participate with Humana. And then one note about the Mayo Clinic. They do not participate with Health Partners, but that has been in place for a number of years. That is not something new.
Thank you. And then you've sort of reiterated the importance of them applying within the open enrollment window. What would happen if someone misses that window? What are the next steps for them?
Good question. If they miss the open enrollment period and they start the new year enrolled in a Medicare Advantage plan, let's say they stay enrolled in the current plan they're in and they start the new year and their providers aren't going to be covered. They have what's called a Medicare Advantage open enrollment period from January 1st to March 31st, where they can change Medicare Advantage plans. The problem is they would have to go the whole month of January with their plan and no participating providers until they were to change. And other than that, there are some circumstances where people can get special enrollment periods, but they're few and far between. So after March 31st, people are really locked in until open enrollment starts next year on October 15th. And then that plan decision they make then wouldn't take effect until January 2026.
Okay, thank you for that. I appreciate it.
Sure.
We have a question in the chat from Peter Cox at NPR, who is asking, what do you expect the ramifications of these changes will be on seniors in the state in the next year, given this timing?
I can take a shot at that first. I think what we are going to see is major changes to enrollments in certain Medicare Advantage plans because it is so important. We hear two things at the senior linkage line primarily. Number one is, I want to be able to continue to see my providers, no matter what plan I enroll in. Most older adults have established relationships with their providers. They may have chronic conditions where they've seen that provider for years and they don't want to have to change to a different provider. The second thing is, can I afford the premiums? How much is this going to cost me? Are there any extra benefits that are going to be available through this plan? But I think what we are going to see is an increase in certain Medicare Advantage plans and a decrease in others as a result of this provider network problem.